Welcome back to the Neuro Health broadcast. Today we are talking all things brain health and mental health. Discussing that topic with us is Dr. Emily Kalambaheti of the Genesis Brain Institute in Tampa, Florida. This was a really fantastic episode, and I don't think a lot of people often make that connection between brain and mental health. And Dr. Emily is going to tell us how those two things are very much related. She's not only going to talk to us about that, but she's also going to talk about all the wonderful things that they're doing at Genesis Brain Institute, talking about different ways to handle both brain health and approach mental health and how they can be synergistic in treatment. So, after a short announcement, we'll get right into it with Dr. Emily Kalambaheti and brain health and mental health. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the show. It's your host, Dr. Joe, and today we are joined by Dr. Emily Kalambaheti of Genesis Brain Institute down in Tampa, Florida. Thank you for joining us today.
Thank you for having me, Dr. Joe.
Of course. I've known you for a while now, so this is the first time I've gotten to interview you, and I'm really excited about the topic that we're going to be diving into today, which is where neurology meets psychology, and I think that's going to be really fascinating for our listeners. Before we get too deep into that topic, though, can you give our audience a little bit of background about yourself and how you got to this point where you're interested in talking about this?
Of course. So I'm an Iowan. I grew up in a small town, really took a liking to just the thought of wanting to help people. Grew up with a mom and grandmas that were nurses, a grandpa that was a doctor. And I wanted to help people, but I got to watch firsthand how some of the medications can have some intense side effects and how juggling those side effects with additional medications can get a bit worrisome at times. So I went to chiropractic college and then got a master's in clinical neuroscience. I'm a diplomate for the Chiropractic Neurology Board. I'm a fellow in the American College of Functional Neurology and also a Functional Medicine Hyperbaric Clinician. And I spent the last 7 years really enveloped in neurological rehabilitation. The thought that the brain has the ability to change, right? Neuroplasticity. You can create new neurons, you can create new synapses, you can create new blood vessels just using technology and rehab techniques. And then it was really over the last year or two that I've been diving into the technology that's become more and more available in the realm that's identified as psychology, but psychology and neurology, we're working with the same organ, right? It's still the brain, it's still the nervous system. So being able to utilize these different techniques to help my patients with concussions, with not just their maybe more physical symptoms like dizziness or nausea, headaches, but also with some of their psychological challenges like the anxiety, the PTSD, the depression that goes along with these disorders as well. So I now work at a clinic where we use transcranial magnetic stimulation and neurofeedback, and I do QEEGs on all my patients and really able to diagnose and treat these different conditions. And our outcomes are quite good, and I'm very excited.
So it sounds like we've got a lot of interesting things to discuss, not just from a concept standpoint, but then also from a technology standpoint. Those are some terms that our listeners may not be familiar with, and I think it's going to be really cool to introduce them to them today. So that's great. So you've kind of had your feet in both worlds, right? The neuro rehab, and now you're more so in the psychological space. So, how do you approach those patients differently? Like you said, we're working with the same organ, but obviously different goals.
Absolutely. I'll be honest, I don't approach them all on my own. I
Mhm.
work with the team, so we have a neuropsychologist on staff, a mental health counselor. I have a neurosurgeon for some of the more like physical, neurological, structural lesions as well. We have a pediatrician, we have a chiropractor, and then there's me.
Mhm.
So I'm the director of rehabilitation. And the way I approach my patients is how I've been approaching my patients my entire career: intense diagnostic testing. We do video oculography, posturography, pupillometry. I now do QEEGs, which are quantitative electroencephalographies. So I really like using QEEGs because you're able to look at the electrical activity in the brain. And I'm
Mhm.
sure your listeners probably know, but the way nerve cells communicate is via electricity. So if you can map out where that electrical activity is in the brain, the frequencies, which we refer to as brain waves, they're too much or too little of which brain wave and which brain regions, you can really start getting a full picture of what's going on in the brain. And then I do order MRIs a lot for people that have traumatic brain injuries or concussions that are grade 2 and above, where there is a loss of consciousness, because I want to make sure that there's not a brain bleed or something else going on. So I start off my patients with about 3 hours of diagnostic testing, but by the end of it, I do feel really confident about where I need to make my referrals and who I want them to see next and what treatment options are available for them.
Mhm. That's so in depth, and that allows you to deliver such personalized care, I'm sure.
Well, when it comes
Um,
to the brain, your brain's as unique as your fingerprint. You deserve a
exactly.
personalized care plan because your brain's one of a kind. I think it's worth spending that extra time at the beginning of their treatment plan to make sure that you're getting it right the first time, and then doing those appropriate checks along the way to make sure that what you think you're changing is what's actually changing.
Exactly. Um, can we backtrack a little bit and talk a little bit more about QEEG? You had mentioned that's something that you do as the as a diagnostic procedure, and then what you might do if, say, someone's theta is too high or whatever it
Mm.
might be.
Absolutely. So for QEEGs, it involves, sitting in a nice dark, quiet room for 20 minutes with a cap on your head that has electrodes over, 19, 20 different points of the brain. And then we put it through algorithms. I utilize the NeuroGuide database to compare. Sometimes I'll be looking into, QEEG Pro as well. But basically, we compare each normative databases to say, all right, for people your age, your gender, your left or right-handedness, is this typical?
Mhm.
And then sometimes it's not. So I think it's intriguing that throughout the example of elevated theta is very common in people that have concussions or traumatic brain injuries. Elevation of any of that slow wave activity, so like 1 to 7 hertz, can be seen quite frequently in concussions. And people will say things like, I feel foggy. I feel like I'm not thinking as quickly. I can remember stuff, but it's like I'm pulling it through sludge. I had a patient actually this morning say that today. Like all my thoughts are, I'm like pulling them out of sludge or pulling them out of mud, where I can get there, but it takes so much more effort than it used to.
Mhm.
So when I see that, one, it really validates how they're feeling. Like, yes, you feel like your brain's working slower. Here's a picture of your brain. Look at this increased slow wave activity. It's very obvious that what you're feeling is not just, I feel like sometimes people think that, when I feel something, there's nothing concrete about it. But when you can add that validity to how they're feeling, of yes, here's some objective data measurements indicating that how you're feeling is quite valid.
Yeah.
And then if I can improve those, regulate those brainwave activities, and then they feel better afterwards. It's like, oh, it's not just that you feel better because you're hanging out with me all day. It's you're feeling better because the rehab's working for you, and we can see the changes. So some
Right.
of the treatment options I like to use, QEEG and neurofeedback go hand in hand. So neurofeedback is EEG based biofeedback, and I do like using heart rate biofeedback, breath rhythm biofeedback as well in my practice. But neurofeedback or EEG based biofeedback allows us to hook up a couple of electrodes to your head, measure your brainwave activity, and if you're trending towards healthy or normative, Your screen will be lit up. You'll be getting some sort of feedback, whether that's a screen or a sound or a game. And then if you're trending away from that, you might be losing the game. The screen might be fading to black. It's actually a form of operant conditioning. So if you remember, like Pavlov's dogs,
Hmm. Hmm.
Pavlov rang a bell and the dogs came and then they ate. And then that in between is that when the dog started hearing the bell, they might be excited for food, but what their brain was doing was preparing them for food, increasing salivation, right?
Hmm.
And that's subconscious. It's not like
Hmm.
the dogs or even us as humans think to themselves, I want to salivate right now. It just happens. So your brain can learn subconsciously through this operant conditioning of what it needs to do to prepare itself to get that reward. Like, ooh, my reward's getting taken away. I know how to switch my brainwaves back to healthy so that I get that reward. And if you do that enough, you can start creating that neuroplasticity or creating more permanent or long-term changes.
Yeah. And I want to reiterate what you said about the validation that you can provide with QEEG, because I mean we see quote unquote invisible injuries all the time, right? So especially maybe psychological conditions such as anxiety or brain fog is very much an invisible thing. Like you cannot see someone else experiencing brain fog. You can see them maybe exhibiting brain foggy like behaviors, but you cannot measure their brain fog. And I know that's not exactly what QEG is doing, but if you can create a correlative picture to say like, okay, this is a kind of black and white image or colorful image of your brain, showing that, your brain waves are not behaving in a way that they ought to, and this is consistent with a brain fog pattern. And if we can get that lower or get that better, we'd expect your brain fog to improve, right?
Exactly. And it takes a lot of pressure off of them. I feel like and you probably see this in your practice all the time. You get these patients come in here and they're like, I don't know if my brain's hurt or if I'm just going crazy. And I'm like,
Hmm.
well, the good news is it's probably your brain. And even if you were, quote, just going crazy, that's also your brain.
Hmm. Yeah,
You
you're in
think it's
luck.
all in your head, but that's where your brain's at. So that
Yep.
makes good sense.
I love, I make that joke tongue in cheek quite a bit. People come in and they say, "Oh, everybody told me it was all in my head," and like, well, kind of is, and here's why. But yeah. Um, so you also had mentioned TMS as well.
Mhm.
So can you tell our audience a little bit about what that is and how that's different than maybe what it used to be?
Yes. So transcranial magnetic stimulation utilizes overlapping electromagnetic waves to basically turn on or activate or shut off, inhibit different regions of the brain. It used to be so intense that sometimes people would chip their teeth. It was in the early stages throughout the 90s and the early thousands. It has drastically changed, thanks in a large part to the work that some of these Ivy League schools are doing, like Stanford and Oxford, where they're working really hard on creating solid research paradigms to figure out how intense does it actually need to be? Is more better? And the answer is more is not always better. So for TMS, all my patients come in, we figure out their motor threshold. So we put the overlapping electromagnetic waves, which is like just a big magnet, over their motor strip and see how much it takes to get their muscles to respond. So by activating a part of the brain, how much does it take to get the muscles respond? And that's their personalized motor threshold. And it doesn't really mean if it's higher or if it's lower, it's better. Like that's just what your brain takes to get those muscles to fire. And then we can shift and use a percent of that, usually either 80 or 120, sometimes 110, just depending on the protocol, to activate different regions of your brain. So what's been most researched in the United States is activation of the dorsolateral prefrontal cortex, specifically the left DLPFC for depression. That being said, I did a lot of my studying through the University of Maastricht, so overseas, because they're not just stuck in the thought that TMS is just for depression. They're kind of a little bit ahead of the game than we are here in the States of, oh, if you can activate a region of the brain using this piece of technology, why stop at the
Right.
dorsolateral prefrontal cortex?
Hmm.
So I've gotten a chance to help people that have had strokes or have had or are experiencing Parkinson's. I even had one patient with a neuropathic pain from internal shingles, where And I let my patients know, this isn't widely researched, but here's some studies that really suggest it could be helpful. Are you open to it? And I have
Mhm.
that dialogue. And for a lot of my patients, they say, yeah, I've tried everything else and it's not working. So why not give this non-invasive treatment option a chance when
Mhm.
it doesn't involve changing your neurochemistry, it doesn't involve any injections, it doesn't involve medications, it doesn't involve surgery. Why not
Mhm.
try it? And a
Right.
lot of the risks are quite low. I can cause a headache or maybe maybe a little bit of facial numbness, which has happened one time in the entire time I've been working with TMS. But a lot of people worry about, oh, seizure activity. And the type of TMS that we do now is not the type of TMS that was done 20 years ago, where you could be inducing seizures all the time. So I've never had a patient at my practice have a seizure during or after the TMS or feel like it was caused by TMS.
Mhm.
But the results are pretty fascinating. And I loved it so much that I actually went through and got TMS done myself.
Hmm.
And maybe this is one of the reasons I feel so strongly about it. But for a lot of my life, I have suffered from depression, runs in my family, unfortunately. So maybe genetically, I have a little predisposition. And when it comes to depression and being a doctor, I care about my patients immensely and I want
Mhm.
them to get better. And I want to be the best version of myself I can be so I can help them to the best of my abilities.
Mhm.
So last year, in the fall of last year, I went ahead and did a full round of TMS and I managed to get off of all my, you know, I was on Wellbutrin, I was on Wolfexor or Effexor, got off all of that. And
Mhm.
2024, I'm prescription drug free and feeling really good. And I can say firsthand that it doesn't hurt and the
Mhm.
results are long lasting. And I'm really excited to be able to offer this to patients that either have depression that's not responding to medications or depression after a head injury, which doesn't always respond the same way
Mhm.
as other types of depression. And then being able to use that creatively with some of my rarer cases that come in, the patients that have these conditions that aren't being helped otherwise, it's been really fulfilling.
Yeah. Well, congratulations on that personal accomplishment, and thank you for sharing your story there. Because I mean, patients can then connect with you better, and feel more, I guess, comfortable in going through that therapy. So that's great. Um, And I think you had mentioned, you had been on so many medications and so many people with depression are. And a lot of times, just from an outsider's perspective, it seems like, um, you know, almost like darts are getting thrown at the wall, trying to see what sticks, which one is the most effective medication. Let's try you on this. Let's try you on this dose of this pharmaceutical for this amount of time. Hopefully it works. If not, we'll change it up. Outside perspective, of course. But I think that's where, again, I'm so excited by things like QEEG, neurofeedback, TMS, because it does seem pretty specific, right? Yeah. And I guess a follow-up question too with the TMS and the neurofeedback. Do you find that by pairing the two, you actually get better and quicker results?
Yes, I don't have a white paper published to prove this, but anecdotally, I would say absolutely. And I don't
Hmm.
just do neurofeedback and TMS. I'm also doing
Hmm.
hyperbaric oxygen
Hmm.
therapy,
Hmm.
increasing oxygen and letting it dissolve in the liquid portions of your blood instead of just attached to red blood cells can really decrease inflammation, speed up the healing process. We use photobiomodulation transcranially, so those infrared
Hmm.
lasers,
Hmm.
those super fancy flashlights
Yeah.
can also be anti-inflammatory, increase blood flow to different regions of the brain. And those can't, the photobiomodulation can get very specific, down to 2 square centimeters. And then we're doing that alongside some of the more standard functional neurological rehabilitation techniques like electrical stimulation, like peripheral
Hmm.
and cranial nerve electrical stimulation, with vestibular rehabilitation, with different types of body, eye, and head movements, alongside these kind of newer technologies like TMS or neurofeedback.
Hmm. Great. And I guess a question I also wanted to ask, and I'm glad you brought up the functional neurology work as well. When you have a patient, how do you determine what is going to be the most effective route? Do you employ everything with each patient, or let's say maybe someone has anxiety, for example. Um, maybe the functional neurology route would be the most effective, or maybe the neurofeedback route would be the most effective, or maybe the TMS. I know you're doing a lot of different things, but how do you kind of tease out and determine which one is going to be the most important for that patient?
I'd like to answer this twofold, if you don't mind.
Yeah.
One, I do a lot of diagnostic testing. So the
Hmm.
areas that I'm finding deficiencies in, whether that be eye movements, the vestibular system, whether that's the electrical activity in the brain, what other dysregulation that we're identifying, I'm going to treat those cause. I'm going to treat what I'm seeing,
Hmm.
not just how they're feeling. And then secondly, I don't take medical insurance because I was sick of medical insurance telling me what I can and can't do with my patients. So instead of saying, well, if you want this, it's this, and they only let me do 5, even though I think 20 would be better, or they only let me do every other day, even though maybe every day would make you better faster. We just do packages here. So instead of paying per modality, it's just how many days are you going to be with us? How many treatment sessions do you want? And then
Hmm.
out of those treatment sessions, I'm going to do everything that makes sense with you. If you don't have PTSD or anxiety, I'm not going to do heart rate biofeedback. If
Hmm.
your brainwave activity looks beautiful, I'm not going to do neurofeedback. If you don't have one of the conditions that makes sense for TMS, I'm not going to put you on the TMS. I
Hmm.
will say pretty much everybody could benefit from hyperbaric oxygen. Even the photobiomodulation can be pretty good for a lot of different types of conditions, just decreasing inflammation, either infrared
Hmm.
or red light, depending on what we're working on. But yeah, I just go heavily off of my diagnostics. I also have discussions with my patients. Do you feel comfortable with this? Here's the
Hmm.
research supporting it. Here's the research that doesn't support it sometimes. Is this something you're open to? And I let the patients have a more powerful role in their treatment plan because ultimately it's their brain that we're affecting, and I want them to feel
Hmm.
confident moving forward in whichever treatment plan we do decide. And sometimes the patients will come in, they'll be like, well, I really don't want to do hyperbaric. I just don't feel good about it.
Hmm.
And I'm like, okay, that's okay.
Yeah.
And then after a couple of days, they're like, all right, I think I want to try it. And I'm like,
Yeah.
okay, good. I thought it'd be good for me from the get-go. So I'm glad
Hmm.
you feel good about it. But I'd rather them come to that conclusion and me aiding them with education than me like forcing it on them or doing that fear mongering, like, oh, well, if you
Yeah.
don't get it, I don't think that's helpful. I want
Hmm.
my patients to feel comfortable. I want them to feel confident in the care that they're receiving. And I want it to be their choice. Because the
Yeah.
fastest way a doctor burns out is by wanting someone to get better more than they want to get better. And I've played that game and I've
Hmm.
lost.
Yep.
So I'm at a different point in my career where I want to help my patients as much as they want to get help.
Yeah. That is so true. That is so true. And it's all about having a dialogue, right? All
Yes.
you can do at the end of the day is educate yourself as a doctor, learn as much as you can, convey that information, and try to apply it to that patient to the best of your ability in the best way you can communicate as possible. And at the end of the day, it's up to them if they want to go down that route or if they'd rather do something else. It's totally up to them. So it's always a dialogue. So I love that. I know you had spent a lot of your career specifically in neuro rehab. So I'm curious, now that you're in this space as well, did you find that when you were kind of solely focused on the neuro rehab aspect, that if somebody, say, had something in their psyche that was inhibiting or maybe deterring their ability to heal, is that something that you ran into quite a bit that you didn't feel as equipped to handle until you had this element?
Absolutely. So I had a lot of patients when I was just doing the funk neuro, not really addressing mental health, that would tell me like, oh, my anxiety is getting better, or I feel more motivated, I have more energy, like some of the symptoms of depression. And that was great. But then when they went home, and a lot of my patients would fly to come see me, they'd stay for a week and then they'd fly home. When they got home, it's a different environment. They're getting thrown triggers all the time, like, oh, I felt so good when I was at your practice, but I'm still so anxious when I'm driving, or I was sleeping so well when I was there, but now I'm home and there's all this stress and I just don't feel the same.
Hmm.
And I would give them home exercises and try to find them places for them to go at their own, close to home. But I will say I'm seeing much more of a local community at this point. And having a mental health counselor that I work hand in hand with, having a neuropsychologist that I work hand in hand with has been a godsend, both for me and my patients. I love being able to say, like, hey, I hear that you're getting better. And I also hear that there's some trauma that you haven't fully processed, and there are some triggers that set you back. Talk to Nicole, our mental health counselor. You
Hmm.
know, are you open to that? Are you open to maybe processing that? It sounds like there's something else going on. And I can get you feeling better and I can get you functioning better. But if a trigger sets you back and those triggers are happening every day or every week or every month, I don't want
Hmm.
to have to see you all that time. Know that
Yeah.
I love my patients, but I want my patients to live their life. I want them to go out there and experience the world and not worry about doctor's appointments all the time.
Right.
So being able to have them be assessed by a neuropsychologist and then have the mental health counseling. And I love the mental health counselor we have. Her name's Nicole. She's amazing. She's
Hmm.
not just a talk therapy kind of counselor. She does DBT, CBT, exposure
Hmm.
therapy. Like she's really open. She even took one of her patients like to a prison because their biggest fear was doing something awful and ending up in prison. So she's like, let me show you what it's like in prison. If that's the worst case scenario, let's go see what it looks like. You know,
Hmm.
is it as bad as you think it is? Is this something that, let's expose you to these worst fears and then see.
Hmm.
And I just think that's amazing
Yeah.
to have mental health counselors out there that are willing to go that extra mile, that extra step. And having things like CBT, which we know works well. You know, the research is quite sound. And being able to give her the QEEG that I read and say, these are the brain regions, these are what I'm seeing, here are some signs of depression, some signs of anxiety, this is what the patient says. And then having her and I team up and say, all right, I'm going to work on this. I'm going to do some exposure therapy mildly using virtual reality assisted biofeedback, and then working
Hmm.
with the neurofeedback. Maybe we do some TMS, maybe we do some other stuff, and then having her also be addressing these, maybe the childhood traumas, maybe the later in life traumas, maybe the anxieties around driving, and being able to address them and help them find techniques to excel, not just in the office, but in life. And
Yeah.
I think that's been very helpful for the patients.
Yeah. And that just speaks to the dedication that you and your coworkers are willing to go to and put in for your patients. And, good luck with getting insurance to cover a prison visit. But that
I know.
is
Good luck getting them to
exactly
cover anything, right?
right. But that's exactly what that patient seemed to need. So so I'm with you there on the insurance model. But um, so Dr. Kalambaheti, we are closing in on time, but I wanted to make sure that we had enough time for you to give us any closing thoughts and also to let us know where our listeners can find out more about you and your team.
Absolutely. So if there's, a closing thought that I could provide, I just want to let people know that there's hope out there. Just because you've tried it all 10 years ago doesn't mean that that's all there is to try today. And even if you try everything there is to try today, neuroscience and brain-based research and treatment modalities are exploding. The
Hmm.
research is coming at us from all angles. There's so many organizations, so many technology firms, so many people that care, that are putting the time and effort in to progress this field. I do feel for a long time people were not paying attention to the brain. And I feel like the brain's day has
Yeah.
come. It might be the year of the dragon, but I feel like it's the decade of the brain,
The
right?
decade, it is
So
definitely, yeah.
I just want people to know that
Hmm.
don't give up hope. Even if
Hmm.
you've done everything you can today, that's not to say that tomorrow there might not be other options out there. The technology is
Hmm.
getting better, the research is getting better. So just have hope. Keep trying. It's
Yeah.
worth it. You're worth it to keep trying.
Yeah, that's so true. And it seems like there's always new technology coming out. There's always new approaches coming out. The research is always evolving, and we're still in kindergarten when it comes to learning the brain. So don't give up hope, like she said. So, and then where can people find out more about you if, you know, is there anywhere you regularly post, or is there a clinic website they can go to?
Of course. course. So I work at Genesis Brain Institute. So our website is just genesisbraininstitute.com. You can always reach out to me on LinkedIn. I have a professional Facebook page. I'll be honest, I'm terrible at social media, which is why I do not own my own
Yeah.
practice. I work
Hmm.
alongside other people because I cannot keep up with the world of social media. But you can always reach out to me personally too. It's just dr.emily@genesisbraininstitute.com. If you have questions, I'm here for you. Use me as a resource. I kind of
Hmm.
joke. I didn't spend all those years going to school and then going to more school and then going to school again and then getting a diplomate and then getting a fellowship and then getting a certification to not want to share it. So if you
Right.
have questions, reach out. And if you want to learn more about the clinic that I'm at currently, it's genesisbraininstitute.com, and you can see all the amazing team members I work alongside with every day and some really cool patient testimonials.
Yeah. Well, thank you for being such a great resource to your patients and our listeners now. So this was a fantastic episode, and I really appreciated you coming on today.
Thank you so much for having me, Dr. Joe. I really appreciate the reach out and the opportunity just to share something I'm very passionate about.
Yeah, yeah, and I love seeing that someone in our field is, making such strong headway in such a innovative clinic like this. So this is great to see.
I feel
So
blessed. I feel
yeah,
very lucky.
yeah.
Both.
Well, until next time, I'm excited, but we'll let you go for now, and then for everyone else, take care.